You may have seen scary posts about Tylenol in pregnancy. You might even wonder, what is the role of Tylenol in arthritis? Let's find out, what do trusted health organizations actually say. Let's separate facts from fear so you can feel safe and informed on your healthy choices. Hi, I'm Dr. Ananta Subedi, a board-certified rheumatologist and the arthritis doctor at the Rheum Doc. I help arthritis warrior like you live fuller lives with evidence-based medicine and whole person care. Today, let's talk about Tylenol, the acetaminophen, what it helps, what it does not, and how to use it wisely alongside your treatment plan and lifestyle pillars. Let's start with the basic questions. What is Tylenol? Tylenol, also called acetaminophen or paracetamol, is a pain and fever reducers. It is not an anti-inflammatory medication, so it does not calm joint inflammation like non-steroidal anti-inflammatories such as ibuprofen. That's the key to understanding when it helps and when it does not. Now, a quick tip: if your pain is mostly aches and soreness without much swelling, Tylenol may help take off the A's off of your pain. Now, other good and important question for all the arthritis warrior is, how well does Tylenol work for arthritis? Now, let's take an example of osteoarthritis. Large studies have shown a modest benefit for pain relief in osteoarthritis of the hip and the knees, which is smaller than the benefit we get from non-steroidal anti-inflammatories. And Tylenol does not work for a long period of time. Some guidelines have moved even away from recommending routine use of Tylenol in osteoarthritis because it's not as effective. In those cases, non-steroidal anti-inflammatory might be more effective, but we have to be cautious regarding the side effects of non-steroidal anti-inflammatories. Now, let's talk about the role of Tylenol in rheumatoid arthritis and other inflammatory arthritis conditions. Because Tylenol does not reduce inflammation, it is not good enough for joint inflammation such as rheumatoid arthritis. In RA, many of you are aware that disease-modifying anti-rheumatic drugs are the foundation for treatment of rheumatoid arthritis. Tylenol can be an adjunct for breakthrough pain, but it does not control the disease and it does not control your inflammation. So it is not as effective. Now, let me give you a practical example of one of my patients in the clinic. He's a 52-year-old male with rheumatoid arthritis, and he says, Tylenol made my mornings a little easier, but swelling kept on returning. Then we made some treatment changes. We optimized his disease-modifying anti-rheumatic drugs that really reduce his inflammation. He still keeps Tylenol for occasional bad days, but the real win was treating the disease more aggressively at the root cause. Hence, DMARD, the disease-modifying anti-rheumatic drug, is the key in managing rheumatoid arthritis. Tylenol could be one of the medications that can help reduce some of those pain. Now, let me ask you all, the arthritis warrior, a quick question. What type of arthritis were you told you have? Osteoarthritis, rheumatoid arthritis, or something else? Please comment below. It matters for choosing the right tool. Now, one of the most important questions, the safety of the medication, the good and the guardrails. So why many clinicians like Tylenol? Compared to non-steroidal anti-inflammatory, Tylenol does not raise the risk of stomach bleeding, and it also does not worsen your blood pressure or heart disease or the kidney disease. This can be important if you have cardiovascular disease, kidney disease, or you cannot tolerate NSAIDs due to ulcers in your stomach. But the biggest caution is your liver. Stay within the maximum daily dose, commonly up to 3,000 mg to 4,000 mg a day for healthy adults. Many clinicians, we try to target Tylenol not more than 3,000 mg per day for regular use. Be extra careful with combination products such as cold and flu medications, so you don't accidentally double dose on Tylenol. Alcohol use can also increase your risk of liver disease, and the FDA highlights the overdose danger of using Tylenol with all of these other medication and alcohol. And if you have liver disease, or if you drink regularly, always talk to your doctor about the lower level of Tylenol that you can use. Now, some of you might be taking a medication called warfarin, also a blood thinner. There has been some studies which has indicated that use of Tylenol with warfarin could cause interaction, causing your risk of bleeding. So always check with your doctors if you are taking Coumadin or warfarin. Now, let's go back to the biggest noise we are hearing all over: pregnancy myth and facts about Tylenol. Major health bodies affirm acetaminophen or Tylenol remains appropriate during pregnancy when needed at the lowest effective dose, and current large studies have not shown a causal link with autism. There might be some association but no causation. So it's very important to know the difference. Is it linked or is it causing the problem? So always be mindful and ask the question whether this is a causal link versus a cause of the problem. But the bottom line is always use the minimum effective dose and talk to your doctors whether you really need Tylenol or not. Now, as a rheumatologist, let me go back to the role of Tylenol and the arthritis. Now, you might wonder, where does Tylenol fits in the arthritis treatment plan? If you have osteoarthritis, such as knee, hips, or hand, try the topical medication like diclofenac gel, exercise, and weight management. That could be helping you manage your osteoarthritis pain. If you cannot use non-steroidal or you need occasional extra pain relief, Tylenol is your reasonable good option. Track your response for 1 to 2 weeks. If there is improvement, you can continue using it in consultation with your doctor. But if it is not helping you, you may not need to continue the Tylenol. Hence, keeping a diary of your pain could be a good tool to help you guide on whether the Tylenol is helping you or not. Now, if you have rheumatoid arthritis or any other form of inflammatory arthritis, prioritize disease-modifying anti-rheumatic drugs with treatment to target goal. Use Tylenol as needed for pain spikes, not as your primary controller. If you are needing it most days, you likely need to make some treatment changes for your rheumatoid arthritis. Talk with your rheumatologist. Now, let me also summarize some of the important dosing basics. If you are a typical adult, common doses of Tylenol ranges from 325 mg to 1000 mg per dose, and it is typically spaced every 6 to 8 hours, but do not exceed more than 3000 to 4000 mg per day. Always count and calculate the number of Tylenol that you are taking and how many milligrams you are taking per dose and then per day. And the most important thing, avoid Tylenol if you have significant liver disease unless cleared by your doctors. Now, let me get your experience. What's your personal sweet spot dose of Tylenol and how do you time it? Share your thoughts and how you are doing so that we can share with other colleagues in this community. If this video is helpful, hit the like button and share it with your friend who is also weighing in the pain relief options, whether to take Tylenol or not. Now, let me also reframe your thought. Now, Tylenol could be a pain reliever in your daily life, but we need to think bigger. We need to think your whole health. Tylenol can lower your pain perception, but your daily choices lower the need for the pain medications. Hence comes our NESSCAR, your NESCAR framework with the 4F fuel. N is your nutrition. Add an anti-inflammatory food at least 1 meal a day. Number 2, exercise. At least 5 to 10 minutes of joint-friendly movement like chair yogas or walking. Then come your sleep. Protect at least 7 to 8 hours of sleep. Pain is louder when sleep is short. So that's why always try to prioritize your sleep, which can even help you reduce your pain. Then comes your stress. 3 minutes of box breathing could reduce your stress and decrease your pain. Now comes your checkpoints. Always track your pain, track how much Tylenol you are taking, don't exceeding the recommended dose. Then comes the avoidance. Keep alcohol low as possible and avoid alcohol when you are taking Tylenol. Your liver will be happy. Now then comes the relationships. Ask a family or a friend to be your best company so that you are in a company and you have less pain. Now then you can fuel your NESCAR with the fuel of 4F: faith, family, friends, and fulfillment. That'll definitely help you reduce your pain, and you may not even need Tylenol. Now let me highlight the key concept that we talked today. Think of Tylenol as a mild pain reliever, but not as an anti-inflammatory. If you have mild osteoarthritis, it has some good benefit, but also consider other treatment options for your osteoarthritis. If you have rheumatoid arthritis that is not well controlled, talk with your rheumatologist so that they can change your treatment plan, including addition or change of your disease-modifying anti-rheumatic drug. But keep Tylenol as your friend to minimize some of your pain. And the safety first. Always look at the amount of Tylenol you are taking, not exceeding the recommended dosing. And avoid Tylenol if you have liver disease and if you're drinking alcohol. And during pregnancy, if you have arthritis and pregnancy, use the lowest dose possible that is able to manage your symptoms. And always talk with your OBGYN so that they can guide you what is the safe limit for Tylenol. Now let me go back to 3 action items from today's video. Number 1, count your milligrams today. Add up all the acetaminophen or Tylenol from every product you are taking. Stay within your doctor's recommended dose, that is less than 3,000 milligrams per day for routine use. And number 2, pair your Tylenol with motion. Do at least 5 minutes of gentle activity right after a dose of Tylenol. Movement with analgesics often beat your pain. Number 3, phone a friend. If you are hurting, if you are stressed, call a friend so that they can help you relieve your stress and relieve your pain. Then you can go to Tylenol. Finally, all of my arthritis warrior, you are not alone. Together, we can move from pain to possibilities. Please subscribe, comment your questions, and share this with someone who needs clarity regarding Tylenol. Now, we'll be coming up with more videos like this. Please stay connected. Take care. Bye-bye.